the header. Okay. Then after that, what you can see, emblem of the sponsor is given, right? Then after that, what is next? A heading is given, protocol, clinical trial protocol. Then after that, what is next? There is a phase information they're given. Then after that, what they given next? What is next given? They given some information about the study. Right. So like that, the first page that we can see. Okay. I will show you the upcoming informations later. Okay. Now what we can see, there is an inclusion and exclusion criteria I will present. What is inclusion and exclusion criteria?
Eligibility criteria.
Eligibility criteria. Okay, so what is eligibility criteria for selection of a suitable subject into the study? Okay, there is a criteria to be present. So is it to someone personally avoid from the trial?
No, ma'am.
No.
No.
We have to get a proper patient who did not have any safety related problems, who will be apt for the study. For that, inclusion and exclusion criteria we are choosing. Okay, so there will be a criteria will be present, and it's based on different factors. Can you tell me some of the factors that we can say related to this inclusion exclusion criteria?
Age, sex,
Yeah, of course, age of the patients will be there.
sex,
Yes, sex,
race,
gender, then
previous treatment history,
previous informations like it will mention that some of the medical conditions subject may have, and in some of the criteria like a proper duration of that disease condition also will be present for that. For example, type 2 diabetes mellitus, it should be a new patient like who is recently diagnosed, or otherwise type 2 diabetes mellitus who should be diagnosed with at least 2 years. Okay, so like that, that medical condition in which the study need to be conducted, that information, approximate duration also related to that, age of the disease condition, like that informations will be present. Then
any allergic conditions,
that's exclusion. Now it's about inclusion. What will be next? It will be contain information that some of the medicine subject must be taken. Okay, some of the medicine patient must be taken, and for that also they will give some in that maximum this dose, or if the patient is taking that medicine, there must be less stable dose for a certain duration of time. Okay, so presence of any medicines with a proper stable time period related information also we can see in the inclusion. Okay, then in some we can see some of the any diagnosis related procedures will be there, or any lab test or any other test related informations we can say. It's common that for the diabetic study they will give like an HbA1c criteria. Okay, so some HbA1c criteria, that's for the diabetic study I'm only giving. So like that, according to the indication in which the study is giving, maybe any diagnosis related procedure or any criteria also they can be added in that. Okay, then what is the most important things? What is that? Patient must be signed.
Informed consent.
Yes. Patient must be signed informed consent. That's very important criteria in the inclusion. So all the inclusion criteria answer should be yes or no. All the inclusion answer should be yes or no.
yes,
It should be yes. Yes. It should be yes only. All the inclusion criteria, it should be yes only. And in case suppose if any of the inclusion criteria which answer is no, then patient will be in or out.
Out.
yes. If any of the inclusion criteria is meet as yes, sorry, as no. If any of the inclusion criteria which is meet as no, then patient will be out from the study. Out. Okay, understood. Then what is exclusion? Exclusion.
Yes, which makes the subject ineligible for the study.
They will be ineligible. They will not be not eligible for the study if they meet that particular criteria. Okay. Exclusion. They will be out from the study if they meet. What may be these exclusion criteria?
And the subject does not fall into the inclusion criteria.
No. There will be lots of when we are comparing with the inclusion and exclusion, what we can see, we will get lot of exclusion. The number of inclusion usually it will be very less number, but exclusion that will be contain lot of points. We can see that. Suppose if inclusion is 5, then exclusion will be 20. Okay, that any of the criteria should not meet. So can you say any examples of this exclusion? Like basic exclusion criteria.
It's not allergic conditions.
Allergic condition with the investigational product any combo. Okay, if the patient is any non-allergic case with any of the product, any of the component of the investigation product, then they will be out. Okay. Then,
Vulnerable population.
sorry,
Vulnerable population.
vulnerable population. Okay. Then, like mostly they will give that pregnant lactating case. Pregnant lactating woman will not be eligible for the study. Then, what is next?
Ma'am, age.
Age is inclusion, not exclusion. Age criteria is a part of inclusion only.
History of disease.
History of some disease condition, they can give it. For example, if they have any recent, any significant event happened. For example, if recently if there any stroke happened. Okay, these are just example only. Okay. Recently, if they have any stroke or if they have any myocardial infarction, like that, if any issues which is recently identified, so they will be given exact time period also. For example, last 8 weeks or last 6 months. Okay, like that, if there are any significant, any clinically significant event happened recently, then they will be out from the study as per the exclusion. Okay. Then,
Ma'am, if they are taking any medicine that might
there may be some prohibited medicine also which will be involved in the study. If they are taking that particular medicine also, we cannot take. Okay, so list of some medicine information also we can see. Then, some abnormalities in the laboratory parameters. Okay, abnormalities in laboratory parameters. So that exact point of that abnormality criteria, they will give it. Okay, like any SGOT, SGPT related things, creatine related things, HP level. Okay, so like that, there will be a point they will give. If that above or below that, then they will be out. So that's some of the abnormalities in the laboratory parameters. Then serology positive patients. Serology positive. What is that? Serology positive. What may be that? HIV, hepatitis. Okay. They will not take it normally for this study. Then if there are any malignancy, any cancer related things. Okay, so cancer patients, they usually are participating only that cancer studies. For the other study, we will not take that type of patients. Okay. So if any psychiatric related problems have, then also will not take it. Then,
mental health.
that I told, psychiatric related things. Okay. Then if there are any alcohol abuse or any drug abuse, they will not take it. Okay. Then if they recently participated in a clinical trial, if they recently participated in a clinical trial also, they will not take it. Usually they are telling that 30 days, some of that criteria which we can see same for every study. Okay, so like that, some criteria which we can see common in our exclusion criteria. Comparing with inclusion and exclusion, exclusion will be lot of points will be there and inclusion very short. Okay, so all the answers for the exclusion should be yes or no to make someone as eligible for the study. All the points related to exclusion should be yes or no to make someone as eligible for the study.
It should be no.
Yes, it should be no. All the inclusion, it should be yes, and exclusion answer, it should be no. Then only they will be able to be participate in the study. They can meet the eligibility criteria. If any of the criteria is not met, then they will be considered as what?
Ineligible.
For that now we are using the term screen failure. Okay, they will be known as screen failure. What is screen failure? Okay, because screening in visit we are doing all the activities. Okay, what is screening visit? What is screening visit?
Screening is done to start enrolling the subjects in the trial.
Screening is doing to check the eligibility of a subject into the study.
Patients are eligible or not for this.
They are eligible or not for that screening we are conducting. So first we will do what we will do. We will take the consent from the trial subject. What? We will take consent. ICF informed consent we will obtain from the subject. After that only any of the eligibility related tests we can do. Okay, so in which visit we are doing that screening visit.
Ma'am,
Yeah.
screening and monitoring is different things.
Of course. Screening, which is an activities, it's like a patient visit.
Okay, ma'am.
Monitoring, what is that? Monitoring, which is the visit CRA is performing at the site to check the doctor.
Okay,
Those
ma'am.
are
Sure.
entirely different. Understood?
Yes, ma'am.
So that's about the inclusion and exclusion criteria. Then after that, what is contained? It will be contain information related to informed consent form process. What is informed consent form?
It is a document in which the consent or the permission is taken from the subject taking part in the trial.
So informed consent, it is a procedure in which we are obtaining consent from the trial subject. If they are willing to be participate, then we will obtain their consent. So by signing in the document, the subject can show their interest to be participate in the study. So here that information that will be contained, what is informed consent, okay, what is the importance of taking informed consent, and according to the guideline, informed consent have to be obtained. While we are explaining the study related information to the subject, we have to use the language which is comfortable for the subject, have to provide enough time to the subject to take their decision about the study. In case if any vulnerable populations are involved in the study, what we have to take care. Then in case if any audio video recording of informed consent which is required for the study, that related information also we can see. Okay. So it's important to know that what is informed consent. Okay, so everyone they should be know about that, how to obtain the informed consent. What are the points should we discuss with the subject? Okay, all the information we should know about it. Okay, so informed consent related information also here we can see in the protocol. Okay, and after that, what it will be contained? Visit schedule. Okay. So what is contained in the visit schedule? What is present in the visit schedule? What is present in visit schedule?
Timings when when the patients have to visit the site.
When the visit need to be conducted. Okay, when any visit need to be conducted. So that timeline related to the visit. Then in each visit, what are the activities need to be performed? Okay, in each visit, what are the activities that needs to be performed? Related information that we can see. So commonly, what are the name of the patient visit which is involved?
Screening visit.
Screening visit. Then
Run-in visit, baseline visit,
run-in, baseline, follow-up, end of the
follow-up.
treatment, safety follow-up. So like that, lot of visit which we can see. So these information which is given in the visit schedule section. Okay. What is the duration for conducting this visit? And in each of the visit activity. Okay, in each of the visit activity, what are the procedures which we have to be performed in each of the visit activity? What are the procedures which will have to be performed? All the information which is given in the visit schedule section. Okay, so the day for conducting the visit, the day for conducting the visit. For example, for conducting the entire screening activity, we can take like a -7 days or -14 days or -30 days. Like that time period they are given. Then we have to perform the randomization visit. Then after the randomization visit, when the next visit have to be performed, like in 30 days, 60 days, 40 days, or 12 days. So like that, when the visit. So like that, every visit, when it's need to be conduct, that information will present, including window period also will be present, including the time of window period. What is window period? Window period, which is like a plus or minus timeline they will give. Okay, there is a plus or minus timeline they will give. Why they are giving this plus or minus? Because why they are giving, actually it's mainly for the subject comfortable. Okay, because there is a possibility that if you call the subject on this particular day to perform the study related activity, to perform that visit, maybe our subject, they cannot come on that day. Right. There is a possibility that they cannot come on that day if you call them. So what do we do?